In this video, I'll guide you through natural ways to take control of your prostate health, all without resorting to medications or invasive surgical procedures. It's crucial to acknowledge that prostate health is a significant concern as men age, yet it's often a topic that is overlooked until problems arise. As someone with clinical experience, I've witnessed firsthand how many men neglect their well-being, often waiting until issues escalate before seeking help. This isn't just about the men themselves. Many times, their partners are the ones who step in and urge them to address health concerns that have been ignored for too long. It's a pattern that we see far too frequently in clinical settings. The prostate, a small but essential gland in the male reproductive system, is situated just below the bladder. This gland plays a critical role in the production of seminal fluid and is directly involved in the male reproductive process. However, as men age, this otherwise small gland can begin to expand, leading to a range of health issues. One of the most common consequences of an enlarged prostate is its impact on urinary function. Because the prostate surrounds part of the urethra, the tube through which urine passes, the gland's enlargement can obstruct the flow of urine, causing frequent urges to urinate even when the bladder isn't full. Additionally, the urinary flow may become restricted, leading to discomfort, delayed urination, and a feeling of incomplete emptying of the bladder. The main culprit behind prostate enlargement is a combination of hormonal changes that occur as part of the natural aging process. Testosterone, the primary male sex hormone, plays a significant role in the development of prostate tissue. In particular, testosterone is converted into another potent androgen called dihydrotestosterone, DHT. DHT has a direct effect on the prostate, stimulating the growth of prostate cells and preventing the natural death of these cells. As men grow older, the balance between testosterone and estrogen changes. Testosterone levels naturally decline, and in turn, the relative amount of estrogen increases. This shift in hormonal balance can inadvertently trigger the growth of prostate tissue, leading to enlargement. Understanding the risks of developing prostate enlargement is vital, as it's a condition that affects a significant proportion of men. By the age of 60, around 50% of men may experience benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate. By the time they reach 85, this number climbs to approximately 90%. These statistics highlight just how prevalent prostate issues are in the aging male population. If you're a man, the odds of encountering this condition are quite high as you get older, making it all the more important to be proactive in maintaining your health. Several risk factors can contribute to an increased likelihood of developing prostate enlargement. These include conditions like diabetes and obesity, both of which can disrupt hormonal balances and elevate the risk of prostate growth. For example, elevated insulin levels, which are common in individuals with diabetes, can contribute to a greater risk of BPH. Managing blood sugar levels, adhering to a sugar-free or low-carb diet, and taking steps to maintain a healthy weight are essential strategies for reducing the risk of prostate enlargement. Obesity is another critical risk factor. Excess fat cells in the body can lead to a decrease in testosterone levels, while simultaneously increasing estrogen levels. This imbalance can significantly promote prostate growth. Additionally, a family history of prostate problems can also elevate the risk of developing an enlarged prostate. Genetics can play a significant role in the likelihood of encountering this issue, making it all the more important for men with a family history to stay vigilant about their prostate health. To prevent and manage an enlarged prostate, addressing these risk factors is crucial. Making lifestyle changes such as following a balanced diet, staying active, and avoiding factors that can contribute to hormonal imbalances is key to protecting prostate health. Now that we understand the basic background, Let's delve into the symptoms associated with an enlarged prostate, as recognizing these signs early on can help you take the necessary steps to maintain your health and address any concerns before they escalate. If you're currently experiencing prostate-related issues, one of the most noticeable symptoms you might encounter is incomplete bladder emptying. This occurs when you feel like you never fully empty your bladder, even after urinating. If this resonates with you, it's important to recognize that an enlarged prostate could be the underlying cause of this sensation. However, this symptom is often accompanied by several other telltale signs, which can help you identify the problem early on. These symptoms include nocturia, where you find yourself waking up 2 to 3 times during the night to urinate, incontinence, or the unintentional loss of urine, straining while trying to urinate, a weak urinary stream, a sudden, urgent need to urinate, a delayed or slowed urinary stream, and in some cases, painful urination. So, what should you do if you're facing these challenges? Should you immediately rush to your doctor or start taking medications? While it's always essential to seek professional medical advice, the reality is that there are many natural approaches you can adopt to manage and even improve your prostate health from the comfort of your home. In this guide, we'll explore some of the most effective strategies, including dietary changes, supplementation, and lifestyle modifications that can significantly help with prostate issues. One of the first things to focus on is avoiding any factors that can contribute to increased estrogen levels. High estrogen levels in men can exacerbate the enlargement of the prostate, so it's crucial to minimize exposure to substances that may boost estrogen production in the body. For instance, soy-based products are known to elevate estrogen levels, so eliminating soy protein and other soy-based foods from your diet can help keep estrogen levels in check. Furthermore, it's important to avoid consuming foods that have been sprayed with chemicals, as these can act as endocrine disruptors, mimicking estrogen in the body. Similarly, using plastic containers or cups for food storage can also lead to an increase in estrogen levels, so switching to glass or stainless steel alternatives is a simple yet effective change to make. By cutting out these estrogen-boosting factors, you're taking the necessary steps to reduce one of the key contributors to prostate enlargement. In addition to avoiding estrogen-mimicking substances, it's important to incorporate foods into your diet that support prostate health. One such group of foods is those rich in lycopenes. Lycopenes are naturally occurring antioxidants found in a variety of fruits and vegetables, and they have been shown to help combat the effects of prostate enlargement. Tomatoes, for example, are an excellent source of lycopene and should be included in your diet regularly. Other fruits and vegetables high in lycopenes include papaya, grapefruit, watermelon, carrots, red bell peppers, apricots, and red cabbage. These foods not only support prostate health, but are also beneficial for those managing insulin resistance, as many of them are low in carbohydrates and provide essential nutrients that promote weight loss. Red cabbage, in particular, is an excellent food choice for those focused on managing their blood sugar levels and maintaining a healthy weight, as it is both filling and nutritious. While diet plays a pivotal role in managing prostate health, supplements can also provide valuable support. However, it's important to remember that supplements should not replace a healthy lifestyle, but rather complement it. Simply relying on supplements without addressing dietary and lifestyle factors is not a sustainable solution. A supplement should always be viewed as an enhancement to your overall approach, not a substitute for healthy habits. To effectively manage prostate enlargement, it's essential to focus on a diet that reduces blood sugar, decreases inflammation, and promotes weight loss. Once you've made these adjustments, you can then add supplements to further support your prostate health. Some of the most beneficial supplements for combating prostate issues include green tea extract. Studies have shown that green tea has significant anti-inflammatory properties and can reduce pressure on the urethra, helping alleviate many of the symptoms associated with an enlarged prostate. You can take green tea in supplement form, but drinking green tea regularly is also a great option. The antioxidants found in green tea can work to improve overall prostate health while providing additional benefits such as reducing oxidative stress and supporting immune function. Zinc is another key supplement that can aid in prostate health. Interestingly, estrogen can inhibit the absorption of zinc in the intestines, and as men age, their estrogen levels naturally increase, which can contribute to a deficiency in zinc. Zinc plays a crucial role in the proper functioning of the prostate and in regulating the body's immune response. By ensuring you're getting adequate zinc through your diet or supplements, you can help counteract the effects of estrogen and support the health of your prostate. Incorporating these natural methods into your routine can significantly enhance your ability to manage prostate health without relying on medications or surgical interventions. However, it's essential to adopt a holistic approach that includes not only dietary changes and supplementation, but also regular physical activity, stress management, and overall lifestyle improvements. By addressing the root causes of prostate enlargement and making these proactive changes, you can take control of your prostate health and improve your quality of life as you age. One of the critical nutrients that can significantly help with prostate health is zinc. Zinc plays a vital role in the proper functioning of the prostate, and supplementation with zinc can reduce the risk of deficiency, which is quite common as men age. But its benefits extend beyond just preventing a deficiency. It also plays an essential role in managing prostate enlargement. Zinc works by reducing the production of dihydrotestosterone, DHT, a potent androgen that has been shown to promote the growth of prostate cells and contribute to prostate enlargement. By inhibiting the binding of DHT to androgen receptors, zinc supplementation can help alleviate many of the troublesome symptoms associated with an enlarged prostate. This makes zinc an invaluable supplement for maintaining prostate health. However, while zinc is essential, it's not the only supplement that can help. Several other natural options can also support prostate health effectively. Let's explore some of the most well-researched supplements that have demonstrated significant benefits. One of the most powerful and widely recognized supplements for prostate health is saw palmetto. Saw palmetto is derived from the fruit of a small palm tree and has a long history of use in supporting prostate health. Several large-scale studies have confirmed its efficacy. For example, a systematic review of 18 randomized controlled trials involving over 3,000 men found that saw palmetto was highly effective in improving symptoms related to benign prostatic hyperplasia, BPH. Additionally, an analysis of 21 clinical trials with a similar number of participants corroborated these findings. Saw palmetto is particularly effective because it inhibits an enzyme called 5-alpha reductase, which is responsible for converting testosterone into the more potent androgen, DHT. By reducing the levels of DHT, saw palmetto helps to prevent prostate enlargement. Furthermore, it has been found to prevent DHT from binding to androgen receptors, which can inhibit prostate cell growth. Saw palmetto also helps maintain a healthy fluid balance within the prostate tissue, further supporting overall prostate health. Another surprising yet highly beneficial supplement for prostate health is cranberry fruit, but not in the way you might expect. While cranberries are often associated with urinary tract health, their role in prostate health is equally important. The use of cranberry for urinary health dates back to Native American practices, and modern research supports its traditional use. Cranberry fruit is rich in phytochemicals, such as proanthocyanidins, flavonols, and triterpenoids, which have powerful antioxidant and anti-inflammatory properties. A clinical study that supplemented men over 45 years old with 250 to 500 milligrams of full-spectrum cranberry fruit powder found significant improvements in prostate health, particularly in the reduction of BPH symptoms. It's essential to note that consuming whole cranberries will not yield the same results as using a concentrated cranberry powder. The specific compounds found in the powder are more potent and more bioavailable, making supplementation the most effective method of benefiting from cranberry's properties. In addition to supplements, certain bath therapies can also support prostate health. One such therapy is an Epsom salt bath. Epsom salt contains magnesium, which is known for its muscle-relaxing and anti-inflammatory properties. By soaking in an Epsom salt bath, you can promote relaxation, alleviate muscle tension, and reduce inflammation throughout the body. Magnesium has been shown to have a beneficial effect on prostate health as well, as it can help reduce inflammation in the prostate and improve urinary function. To use this method, simply add a cup of Epsom salt to warm bath water and soak for 15 to 20 minutes. This simple yet effective remedy can make a noticeable difference in your prostate health and overall well-being. While supplements and bath therapies are beneficial, lifestyle changes, particularly in the area of exercise, are equally crucial. Regular physical activity is essential for reducing overall inflammation in the body, and it also helps to reduce fat, which is a key contributor to the production of estrogen in the body. Estrogen, in excess, can exacerbate prostate enlargement. Research from Harvard University has shown that even moderate exercise, such as walking every day, can reduce the risk of developing BPH by as much as 25%. The same study also concluded that men who are more physically active are less likely to experience symptoms related to prostate enlargement. Exercise helps not only to manage weight, but also to reduce inflammation, improve circulation, and maintain hormonal balance, all of which are essential for maintaining prostate health. The key takeaway here is that improving prostate health is not just about taking supplements or medications, it's about adopting a holistic approach. Lifestyle factors such as diet, exercise, and stress management must all be considered in tandem with supplementation. You cannot expect to achieve lasting results by focusing on just one aspect of your health. It's the combination of all these strategies that will lead to the best outcomes. For instance, you may take a supplement like saw Palmetto, but if you continue to eat an unhealthy diet or neglect exercise, you're likely to see minimal improvement. On the other hand, by combining healthy habits, such as consuming a diet rich in anti-inflammatory foods, incorporating exercise into your routine, and adding supplements as a supportive tool, you'll begin to see significant improvements in your prostate health over time. It's essential to be patient and consistent. Prostate health, like any other aspect of your well-being, requires ongoing effort and dedication. Implement these strategies week after week and month after month, and you'll begin to experience the benefits of a healthy prostate. One common mistake many people make is expecting quick results. A few days of supplements or 1 week of exercise will not solve the issue. You need to commit to these changes for an extended period to see the effects. Whether you're taking zinc to reduce DHT production or exercising to reduce inflammation, consistency is key. Implementing these changes gradually but persistently will ensure that you achieve long-lasting results. So, if you're struggling with prostate health, remember to approach it with a comprehensive mindset. Prioritize your overall health and well-being by integrating diet, exercise, supplementation, and stress management into your routine for optimal results. This holistic approach will naturally and effectively address the underlying causes of an enlarged prostate, allowing you to manage symptoms and enjoy better health as you age. Remember, true and lasting results come from making long-term changes to your lifestyle, not quick fixes. Be patient, stay committed, and give your body the time and care it needs to heal and thrive.